Yeah, thanks. Okay, thank you, Wilton. Wilton forgot to mention that I met him in 1995, and we worked together on the problem of asbestos in Osasco. First, let me thank you for inviting me to be part of this important moment. I want to congratulate you on the Banimento do Amianto here. And I would say that we, in the United States, we hope that we can follow your leadership sometime in the future. I want to talk about lung cancer. I think that you will probably hear more about mesothelioma than lung cancer at this conference, and as at most asbestos conferences. I want to talk about our second chance at prevention of lung cancer death among asbestos workers. I say second chance because we missed the first chance. The first chance was to avoid exposure, eliminate exposure. We didn't do that, although you clearly are moving in that direction. We didn't do that in the United States, but we have a second chance to prevent lung cancer death, and that's what I want to talk about. So I have to say, I was a little nervous about coming to Brazil because, you know, you read the newspaper and here in Brazil there's political chaos, and okay, you know, we're not so used to political chaos in the United States, but we're learning. And then, you know, you have a president, a former president who is in jail, and of course in the United States we don't have that yet. But I was very comfortable coming here because I'm from New York City. I'm from part of New York City called Brooklyn, New York City, part of New York City. So when I came from the airport yesterday and I saw this sign going to the hotel, I felt at home here in São Paulo. So I've testified in court sometimes. I think that may make the lawyers happy. But I have to, as part of my talk, I always have to say that in case you suspect my opinions. Okay, so what I hope to do this morning, and then again Friday, and maybe later today, is to convince you that the most important cause of occupational disease mortality is lung cancer, and that we can do something about that. And when we met in Osasco in 2000, we couldn't say that. And in fact, until a few years ago, we couldn't say that. But now we can say that, and we need to enact this important medical progress. So lung cancer, it's the most important cause, the most numerous cause of cancer death here in Brazil, in the United States, and throughout the world. Okay, that's not occupation, that's just in general. Okay. When we look at occupation, it's the most important cause of occupational mortality that we have. So it's the leading cause of occupational cancer. More than 50% of occupational cancer is lung cancer. It's asbestos, but it's also diesel exhaust, it's silica, it's arsenic, it's chromium, it's numerous lung carcinogens. And we have an estimate of how many occupational lung cancers we have in the US, and I hope that Eduardo and others will talk about the situation here in Brazil. Lung cancer is the leading cause, not just of, in the world, of cancer, but it is the leading cause of asbestos-related diseases. And it is more numerous than malignant mesothelioma, although I always feel a little uncomfortable comparing them because they are both highly lethal, terrible diseases. And in the US, we know more than 10,000 people die from asbestos-related lung cancer each year because of our previous exposure. So enough of the numbers, because we're talking about people, including people you know, some of your friends, some of your coworkers, some of your patients. Now, Dr. Selikoff, I'm originally from Mount Sinai, and this is the great asbestos researcher, our teacher, the teacher of myself, Arthur Frank, from Mount Sinai. He did his asbestos research, landmark research, 1960 to 1992, and he did the most important study of the insulators who applied the asbestos, and found that 22% died from lung cancer and 8% died from malignant mesothelioma. So you get a sense of the comparison of the two diseases in terms of the number of people affected. Now, this is a history of our use of asbestos, new use of asbestos in the United States, and maybe one of you will show the same slide here in Brazil. And it's a very simple slide, right? We began using in the early 1900s. For the most part, we stopped using in the 1980s, although, as will be spoken of later, we have not banned asbestos. There is still some, too much, but not much, but still too much asbestos still introduced in the U.S. But this is an important, in particular the time, the calendar time, is an important data from this slide. Because you say, what happened to all those people who worked with asbestos during this time period? And they stopped in, well, roughly 1980. And you can ask the same question here. What's going to happen to all the people who have worked with asbestos until now? And now for us, it's 30 or 40 years later, and many of those people are still alive. And the question is, what can we do for these people? The second question that arises from this is, what happened to all that asbestos? Most of it is still in the United States. Most of it is still in the buildings. It's still in the factories. A lot of it is still in the ships. It has not been removed, and so it presents an ongoing risk into the future for workers and for communities. And so we talk about the reservoir for future exposure, because that asbestos will be removed in time. And we talk about a reservoir for future disease because of all the people exposed in the past. And here's an example of a person, this is a case, a person who developed malignant mesothelioma. He was diagnosed with mesothelioma 10 years ago. He was 57 years old, and he was an immigrant from Poland. And he started his work removing asbestos from boilers like this in 1990. Now, you remember from the previous slide, we stopped most of our use by 1980. And in general, people certainly knew that asbestos was hazardous, but not the immigrants, not the people. They did not know, because no one told them that asbestos was hazardous. And so in 1990, he removes this, and they use a hammer, they use other crude instruments to remove the asbestos, no protection, and then 18 years later, he develops malignant mesothelioma. Here's another example of asbestos that was in place. This is the World Trade Center site after September 11, and there was a lot of asbestos in those buildings. And where did that asbestos go? Well, that asbestos went at the site where workers were exposed. It went into the neighboring buildings, which were mostly cleaned by immigrant workers. So when you think about asbestos in place, sometimes you can remove it in a predictable way, and sometimes you can't control how it's going to spread and who is going to be exposed to it. So let's talk about lung cancer. I want to, some of you are doctors and will understand what I'm saying in the next few minutes, but there are others who are not, so I need to explain the way we usually address lung cancer. Most people with lung cancer do not get screened. They don't have an annual chest X-ray or annual CT scan. What happens is they have a history of exposures, and then they are diagnosed as having lung cancer. And then I want to contrast that with how we can actively screen for lung cancer, asbestos-exposed workers and others. So this is the usual way people present. They are healthy until they develop a new cough. They frequently cough up blood. They become short of breath, and they lose weight. Sometimes they develop other symptoms as well. And they go to their doctor, and they have a chest x-ray, and the chest x-ray shows a large mass. Very easy to see. And usually that mass is large. Often it has encroached on the chest wall, and it is often or sometimes spread to other organs. 90% of people who have lung cancer, that is their story. That is what happens to them. They go to their doctor with these symptoms, and they have, eventually when a CT scan is done, this is what it looks like. So this CT scan, of course, gets you a three-dimensional picture of the chest. And what this is a slice. If you think about a slice across the chest, that's what we're looking at. And so this is the front of the chest here, the sternum, and this is the back, right, the spine. And over here is normal lung. But over here is this should be black. This side should be black like that side, because that's what normal lung should look like. But instead you see a lot of extra tissue, and including some fluid down here. This person has an advanced lung cancer. This is all cancer. It involves the lymph nodes. By the way, if I speak too quickly, just tell me to slow down, okay? Because I can't see the translators. So, and there's fluid here as well that develops. So this is what the usual person here in the United States, and the person is saying I have 10 minutes, but I really think she means she's thinking 15 minutes. So now, by contrast, if a person has an increased risk of lung cancer, before they develop those symptoms, we can have them undergo a CT scan. And what are their symptoms? Are they sick when they show up for screening? And the answer is no. This is a picture of their symptoms, which is they have no symptoms. The sky is blue. And by the way, this is the sky in New York City. It always is like this. So especially in Brooklyn. So you should come visit us. Wilton can tell you. But no symptoms, right? This is the CT scan, okay? And here you see normal lung tissue on this side, normal lung tissue on this side, and you also see this small mass, this small lesion, which is a lung cancer. That is an early stage lung cancer. That's stage 1. And this lung cancer can be removed through surgery, and the person can then lead a normal lifespan. They will lose a little bit of lung tissue, but the lung expands, and this lung takes over, and they can have a normal lifespan. And so this contrast between CT on screening and CT when you wait for symptoms is a very large contrast, and makes all the difference to how well the person does. Some people will not go for screening because what they know about lung cancer is that lung cancer kills people. So when they think lung cancer, they're afraid to go for screening. And the reason they're afraid is because this is what they're afraid of, right? They don't know the CT scan, but they're afraid of a death sentence. And I speak here to people who had exposure to asbestos. Actually, what screening allows is this, which is limited surgery and a normal lifespan. So let's talk about our own experience. This is a program that I've been running since 1998. These are at the factories, the research facilities where United States, we built our nuclear bombs from 1943 to 1990. And those workers, many were exposed to asbestos, and they were exposed to radiation, and they had other toxic exposures. And so we conduct a screening for them to look for occupational diseases. And I do it with, in different parts of the country. I would tell you these parts of the country, but you don't need to know them. You just need to know where New York City is, which is over here. And this project we did with the union that represents the workers, the largest industrial union in the United States, the steel workers. And so we were looking in our program for chronic lung disease and a problem with beryllium, which is a special toxin. And we read in 1999, right when we started, we read this new article by Henschke in New York, and she showed that you could use a low radiation dose CT scan, and you could detect lung cancer at an early stage. And we said, we need to do that because our workers that we're responsible for were exposed to asbestos and radiation, and we need to take advantage of this. So we started our own lung cancer detection project, the year 2000, and this was our first scanner. We couldn't use local radiology facilities because we didn't trust them to do a low dose, and also they weren't all that interested. But that's okay, we had our own unit. And this was the start of our program, the year 2000. Here I am, so if you want to know how long I've been working on this, you can see. But this is Senator Mitch McConnell, and he is right now the lead Republican in Congress. He was at our opening because he supported occupational health care for workers in his state. And so we were not screening in Sao Paulo. We were not screening in New York City or Boston. We were screening in the country, in rural areas, in Paducah, Kentucky, and Portsmouth, Ohio. And these are the people, the union workers, who were helping us find people to screen and communicate what the screening was. And here, this is our current scanner. It's parked in the union parking lot, so that workers feel this is my project. This is my program, my health program, because this is placed in their union parking lot. Although, frankly, every CT scanner in the United States can do what we do now. And so this is one of our first, this is a woman who came, this is a regular chest x-ray. The chest x-ray was normal. You can see all lung tissue here. This is the heart. But when we did our CT scan, this is very high up. You see this very small lesion, right? This is 1 centimeter. Here's your ruler, 1 centimeter. So she had an early lung cancer, and she went to surgery. It was removed, and she has done fine over the past 15 years. And here's another example. So I only have 5 minutes, so I'm only going to show a couple of our cases just for, this was a person, a 64-year-old, initial scan showed this small lesion. It was only 6 millimeters. And this was not big enough to do anything about. So 3 months later, we did a scan again, and we saw the same lesion. It hadn't changed. But then 9 months later, we looked at this person. This was 12 months from the first scan, and you can see this is now much larger compared to the previous scan here. And this growth meant either infection or it meant cancer. And in this case, it was a cancer, and this was a stage 1A cancer. So this was a success story. This is how you do lung cancer screening. You follow people carefully, and you then send them to the surgeon at the right moment. And I have some other examples which I don't really have time to show. But I will show this one. Here's a similar, this is a small lesion seen initially, and then we followed this, a 55-year-old man, and then we followed it again in 3 months, and it hadn't changed significantly. And I'm sorry for the people over there, I'm using this, but then, and then again at the 12-month, it had grown significantly, and we, that person went to surgery, and again, an early stage lung cancer. So when you add it all up, we have screened over 13,000 workers for lung cancer screening since the year 2000. It's the largest lung cancer screening program in the United States. It may also be one of the only lung cancer screening programs in the United States. And this is, I have 2 slides. These 2 slides are really the whole story, and aside from the individual stories. We have detected 164 lung cancers, or about 1%, 1 out of every 100 people in our program has been found to have lung cancer. So that's a lot of people. And this is the most important, which is that we have staged 159 lung cancers. So we know whether they're early stage, we know whether they're late stage, right? And so this slide shows you how many were stage 1, which is that 64% were stage 1, meaning 2 out of every 3 people whose lung cancer we discovered was early stage. They could go to surgery and be cured of lung cancer. And another 9% had stage 2, which is also a stage that is favorable that you can usually perform surgery. So 3/4, if you add up those 2 groups, 3/4 of the lung cancers were early stage lung cancers, which meant that we could reverse the odds that we normally know about survival of lung cancer. Remember I said 90% of people who have lung cancer present with coughing up blood, short of breath. They have advanced disease when it's not curable. Well, here we found 75% had exactly the opposite. They had early lung cancer when surgery can make a real difference and people can be cured. So the conclusions from our program are that you can motivate people to go for lung cancer screening. They are concerned about lung cancer, and I'm sure this is true here in Brazil as well. Secondly, and we used a union as an effective way to find people and to motivate them to come for lung cancer screening. And I think to the extent that the unions are involved, but also ABREA and other community-based groups, that is the way to help locate and campaign and find people to undergo lung cancer screening. And I'm sure if you have banned asbestos, which we haven't done, I'm sure you can motivate people to go for lung cancer screening. The technology is available, and I can't speak to Brazil. You all need to, but this is the regular CT scan. You just dial back the dose, and you can do a low-dose CT. It requires resources. It's not easy. I'm not suggesting it's easy, but it can be done. And then finally, we need catalysts. We need people to make this happen. And if not us, then I don't know who will do it. Thank you.